What's up, everybody? Welcome to today's YouTube video. We have a special guest with us this afternoon. Her name is Adriana. She's a remedial massage therapist.
Hello.
Welcome to the show.
Nice to have me. Continue. I'm really happy to be here. I'm excited. We should just keep going. It's fine.
This is really fun.
I think we're doing really well. We've got a good flow here.
Okay.
Which is exactly what's going to happen upstairs. We're going to go into a myofascial decompression cupping session. I have my friend Tash with me today, and we're going to do a bit of a mentoring session. We're going to talk all things cervical, thoracic, lumbar spine, working through ranges of motion, certain cupping pressures, and working how it would work in sort of, with athletes and everyday sort of personnel. Yeah.
Cool. I'm going to be a dummy. I'm the
You're
client.
going to be the dummy? Yes.
What can I expect? I'm nervous.
Don't be nervous. We've done cupping before. But basically, I'm just going to work through your back. We're going to do lots of cupping pressures. We're going to put you in lots of ranges of motion, seeing what feels comfortable, where your tightness and restrictions lie, and then working through that. It's almost like desensitizing the area to create a little bit more mobility and movement.
So,
Yes.
who do you think would benefit the most from our educational video today?
Basically, a lot of remedial therapists to begin with. People probably who aren't comfortable with cupping. This is a really good starting point as to what to do in the back, how much pressure to put on cups, what mobility movements we need to work through, and also just certain cues about when to do it and when not to do cupping.
Cool. I think also members of the community that have either never been to a remedial massage therapist but always wondered what those marks are on the back of the athletes that they see on TV.
100%.
Yeah.
This is going to be for someone who probably has never done cupping before, and it's a really good educational experience to see exactly what it involves. It's not as intense as you think. The marks can look quite full on. They can get quite dark, and that darkness can come from, different degrees of pressure. If you haven't had it done before, how tight you are, how long we leave it on for. There's so many different varying factors, but this is going to be great for anyone who wants to think about their recovery a little bit more, who maybe don't even get remedial massage. They might be prompted to go see a remedial therapist and give it a try and see if it works for them and in their recovery routine.
Cool. For any other health professionals out there, myself as an exercise physiologist, and I know some of my physio friends, we love learning about this stuff as well. So I'm super excited to vibe out and listen to you girls chatting about it.
I'm excited to share it.
And just quickly, Tasha, she's also a
remedial therapist. She's just graduated very recently, and she's a keen learner, and I'm excited to teach her different things with cupping and stepping out of the comfort zone a little bit.
Cool. So a bit of background for you guys. Adriana helps a lot of our community members with aches, pains, niggles, and also general maintenance for staying mobile, keeping everybody accountable with mobility, flexibility, and also helping with range of motion and recovery. When Adriana is not doing handstands and crazy shit at gymnastics, she's also working with the Lions. Adriana's done work with a lot of high-level athletes, and just quietly, she's also my remedial massage therapist and Darko's remedial massage therapist as well. Not that we're high-level athletes or anything. We're down on the bottom of the spectrum.
You might be down on no, you're not down on the bottom. No, they're great clients. They listen exactly to what I'm saying, and they always take my advice on board, which is really, really good. You're very much, what's the word? You're the You're the client that I want.
The superstar client.
Yeah. The ones that listen.
I've benefited from your remedial massage therapy.
That's good.
A lot, yeah. It's all of the things that I often procrastinate and don't do enough of. You're like, oh, this is tight, this is jacked up. Like, we need to work on this. Let's smash this here. But then I really like how you give me the homework and you educate me as well to go, okay, really, you need to triple down on this. Go away, do it, and then that does help keep me accountable. So for our community, I'm excited for them to experience a bit of this learning as well. I know that a lot of health professionals will benefit from this, but also some non-health professionals and other members of our community will get a lot out of it as well.
I hope so.
Yeah. Thank you for this.
Thank you.
Should we get into it?
I think so. Let's go.
Let's go.
A bit of warming balm. Bit of warming balm. We're going to do more like a passive sort of treatment first up.
Okay.
Actually, one of the reasons why we do passive is if someone's scared of getting cups. So you can always just be like, all right, I'm gonna put a cup on your back, see how it feels. If it's tight, let me know. And usually you start off with, say, 2 pumps to begin with. And that's not very tight, is it, Svet?
No.
So then we can do a little bit of dragging, which is a good, quiet thing to start with. And do you want to try that? See how that feels?
Yeah, you can really see the blood flow, can't you?
Yeah.
Pretty juicy.
Very juicy.
Very juicy.
And we're going to do the same to the other side, and we can do it at the same time. We're just creating blood flow and breaking up the tissue that's below. Give that a go.
Yeah, both at the same time?
Yeah, both at the same time. Nice and slow. So this is a technique called dragging. And you'll feel maybe one side might be more fascially tighter than the other side. So it might move a little bit slower. One side might move a little bit more freely, depending on the curvature of his spine.
Yeah, I'm getting that on the left bit.
Yeah, see the left, how it sits up a little bit higher?
Yeah.
So that usually means that this side's a little bit more lengthened. This side I might not have done as tight. So then you'll feel, you see how this side's got a lot more redness through here? That's because he does have a slight sort of curve in that spine through there. So this side will be a lot more compressed through this area. So it'll be naturally redder than the other side.
Yeah.
So dragging is really good for if someone's a little bit nervous with getting cupping to begin with, or if you just want to finish on something a little bit light after a really intense sort of hour session going through the back. Really good for breaking up adhesions in the thoracic, all that sort of stuff. Then we want to do something maybe a little bit more passive. So we're going to put a load more of cups on. When you're putting cups on, you want to kind of pop them in position first. Start off with a low setting on all of them and then increase the setting at a time. So if you do, say, 1 pump or a couple pumps, this is all nice and loose. We can check in with the client and be like, how's that feeling? Svet might be like, yeah, that feels really good. So that means we can up the ante on it. Do you want to try it?
Yeah.
So maybe one nice big one. See how it like grabs the tissue
Straight
and pulls
away.
it together? Yeah.
A full one on each one?
Yeah. On each one. Good. And then we can leave it there for a couple of seconds for him to breathe, relax, get used to the pull and the sensation of the cups. Once he's a little bit more relaxed into it, he might be like, I get a lot of tension through my thoracic when I extend my arms.
Okay.
So this is when the active sort of movement comes into it. But it's still going to be quite passive because I'm going to be in control of his arms, and then I'm just going to raise his arm up into extension. And it's almost like a pin and stretch sort of technique. Yeah. And we hold it here for 10, 30 seconds, relax it, and then we can try the other side.
Sweet.
The other side. So you see how you're really lifting up his shoulders? You want to relax that shoulder blade, let it hug through there, and you're almost trying to extend through underneath here, so you're slowly rotating and allowing him to relax his upper traps through here, and then we're just kind of pulling all through the tissue.
How you feeling, Svet? You alive?
Yeah, feeling good.
You?
Can you feel that stretching through your thoracic?
Yeah, I can actually. Yes, I can. I can also, as Tasha did that, I can feel it on like stretching my left wall back nicely.
Yeah.
You can see that as well through.
You can see that banked up area there as well. Then after a while you can do not just holding, but we can actively go through that range and loosen up. It's almost like desensitizing through the shoulders and the thoracic, getting used to that tissue.
Sweet. Do you want me to give this
Do you want
a
to try that side? Yeah. So nice and slowly. Yeah. Really slowly. You're almost letting it hug the table as you're gliding through. And dropping it down. Good. Cool. I'm going to let that go now. And then another thing that we can do, I'm just going to lightly put this one up again. We can do a bit of we can get even more creative and get him up on his hands and his knees. Jump up on your hands and your knees, Svet. And then we can go into a nice child pose, which is another active stretching, strengthening, lengthening through the spine. And then he can sit up. And if he struggles with extension, then we can do a bit of a cat-cow. So we can drop, we'll go up into that cat and then sink, contract through the cups and go into a cow position, up into a cat position, back into a cow. Good. And then one more. And down into a cow. Good. And then we slowly relax back down onto the table. So you're getting them doing different things.
Yeah.
If he's struggling with rotation, we're going to actually get you back up on your hands and your knees again.
You're working for this treatment.
I was like, God damn it, I've already got him down on his... So if we want to help with rotation in the spine, someone's like, I've got restriction through the spine, then we're going to do something like this, which will help that rotation. So draw your arm through, nice and slowly. Coming through, you're slowly dropping your shoulder. You go to a point where you feel comfortable and you're not pushing yourself beyond the boundary of what you feel is too much. How's that feel? Breathe, yeah. Yeah, probably about there. And then you hold it 10, 20 seconds. You're gonna ask them to take nice deep breaths, so 5 deep breaths. Good. And then we're going to go to the other side. We're going to pretend that's 5 deep breaths. And then the other side. Did you get a nice zoom in of that rotation? Yeah.
Yeah, you get this.
Yes, thank you.
Hold it in this time, Shwet.
Deep breath. Good. Good. Okay, and relax. So that's if you want to do something a little bit more active. And because Svet, you know, is very active himself, you can swing your legs off the side for me. Because he's like a fairly active man and does a lot of stuff, he can handle this sort of pressure of maneuvering and things like that.
Yeah.
If it's someone that's, you know, they've had back issues in the past, I would probably stick to more the passive sort of movements where you're controlling
Yeah.
it. Active is a bit more like they're ready to kind of get full on. Or we can do it seated. So cross your arms across your chest. Sorry. Cross your arms across your chest, drop your shoulders, and then you're going to go through your normal ranges of thoracic sort of movement. So we're going to go into forward flexion. You're going to articulate through the spine, slowly round forward, arching the back. Good. And then slowly moving back up. And then we're going to go into extension, reaching up, extend through the spine. Then we're going to come back to neutral, nice and slow. And you can work through that 3 or 4 times, going from flexion to extension.
You'll see the range differ each time.
Yeah. And each time he goes back into it, you'll find that he can go a little
lot
bit
further.
He's getting very aggressive now.
Yeah.
He's like, yeah, look at me go. Extension is a little bit of a different story. It's a lot harder to create that extension because it's so much traction through the back.
Yeah.
Okay, and then come back to normal. Now we're going to work through, say, rotation. Rotation, I find, is a little bit hard getting them to do it themselves. So I'm going to grab their shoulder and guide them into that rotation. And then relax your trap. And that helps focus through this sort of area. And then we rotate to the other side. And then we come back. Good. Now this time you can do it yourself. So slowly, slowly work through. You're going to stop there, breathe, relax your upper traps, let everything settle. Good. And then rotate back to the other side. Good. So take a deep breath and coming back to normal. Good. Excellent.
How nice is that release?
Good, yeah. Then we retest. So at the start we would have tested, you know, what their range is. So then we retest and we go, okay, what does your forward flexion feel like? Going into it, so rounding through. They'll feel the difference.
You can see the difference.
You can see the difference, and it's a lot more fluid in motion of them moving and then coming back up, going into extension, reaching through the spine, good, and then coming back to normal, and we're going to go rotation. And going to the other side. How does that feel? I think that's the most important part, is asking.
Yeah, feels good.
Feels good?
More mobile, especially on the... Nah. Yeah, feels more mobile.
Feels more mobile, yeah.
I think you'll be good.
Yeah. Okay, good. Let's say they have neck issues
Yeah.
stemming through here, we can ramp up the cups in these areas.
How high up can
Probably.
we actually go with the cups?
I like to stay away from the neck. I kind of would prefer to stick to things around the upper trap and anywhere down that sort of splenius capitis line and anywhere down that sort of lower trap area. Because we're going to do, let's just pop some cups in now. So let's say we wanted to improve his flexion and extension and he's got pain going through that area.
Yeah.
I'm going to pop a cup nice and close-ish to the spine in that sort of zone here. And same with that side. And we're going to do one more around here. I'm trying not to do it too hard on you. Is that all right?
Yeah, go as hard as well.
Go as hard as you want. So now that we work through just flexion and extension of the cervical spine. So slowly articulate just through the neck. Good. Rolling down. Feel the pull, stop there. And then coming back up. And once again, like, you're gonna start small. So it might only be to here for the first round, and then the second round it will go deeper, and then the third round it will go even deeper because he can start to feel that fascial tension just start to lift away a little bit more. So we're really like desensitizing that tissue and creating a lot more blood flow to the area.
Mm-hmm.
And then we're going into extension, good, and relax. And then extension again, relaxing through the traps. Good. And then coming back. And let's say in rotation, they were getting a little bit of that tightness feeling through that levator gap in rotation. That's when you work rotation. So then I'll ask Bet to turn his head to the left and slowly come back to normal, and then rotate to the right. Good. Now let's say come back to normal. Let's say he told me that in rotation he hurts more through his trap and side flexion. So that's when I would take these ones out, and then we would focus on more of the trap, and then we work side flexion and rotation again.
Yeah.
So it's all about asking them, when does it hurt, in what movement,
Yeah.
and where, and then you work through that. So then you pop it here, and then we'll go, okay, let's go side flexion first. So drop your left ear to your left shoulder.
You can see that tension.
You can
yeah.
see him wanting to compensate.
Wanting to
and
bring his full
almost
body
drop,
with it.
Yeah,
Yeah.
his body.
Damn.
And then come back to normal. And slowly just drop to the right side. Don't feel like you need to push it. It will just fall with your head. That's it.
How are you feeling on this one?
Yeah. Feels like I need to do a bit of work on this one.
And then come back
Yeah,
to normal.
it feels really good, but just doesn't feel that mobile.
And let's go again. So dropping to the left.
How am I looking, Tasha?
The left is definitely restricted a lot more in comparison. Dropping to the right.
And we can see the differences of how far his head drops from side to
And where
side.
his body's sitting here, like how he's going.
And he might shift his weight over through his hips, through his back, and go once more to the left. Good. Okay, and then coming back. And now we're going to do work rotation again. So you're going to rotate your head to the right. Good. And coming back. And rotating to the left. And coming back. And once more to the right. Good. And rotating to the left. He's starting to get more rotation now.
Yeah. It
His
flows a lot
head's-
more smoother as well. It's gone rather
Yeah,
than I am
that
turning.
kind of like, yeah. Exactly. So now when we take it off, we retest his range of motion through his cervical. So rolling down through the head. See how nicely that tissue just moves?
Yeah.
It's all like fluid now. And then looking up to the sky. Good. And back to the middle. Oh, look at that extension.
Literally.
What do you mean?
You can
And
definitely tell here on the extension, the
Yeah.
skin's not going.
it's not grabbing.
Yeah.
Exactly. And now rotate to the left.
So juicy. So good.
And to the right. Good. And last time we're going to do side flexion. It's better. And the other side. It's not so much of a taut sort of grab through that area. It's good. Okay. How are you feeling it? Where's your little towel? Where's your towel? There it is. Okay. So let's say they've got tight lower back. We're going to test their lumbar range of motion once again. So
Let's say it's pure hypothetical, not like never.
yeah.
All the time.
Never. All right, so round forward. So you're gonna do flexion through your lumbar.
Articulate all the way down.
Yeah, you can articulate.
Definitely be able to see where it sticks as it goes down.
And the good thing is we've loosened up his upper body now. So this is gonna be a lot more isolated.
Yeah.
Now we can really see how that feels. Now I can be like, Svet, how do you feel? And he can be like, okay, I might be grabbing a little bit on my right-hand side.
So it's left.
Okay. And then coming up. How does that feel? Or do you feel like it's more the left?
Like at the bottom end, it kind of just felt like generally.
Like a drag across
yeah,
the
like
bottom.
a bit of a drag. It
Okay.
wasn't really one-sided.
That's
or
good.
Yeah. Too
And
much.
then and then extension. And so we're going to ask them to really anteriorly tilt through the hips.
Yeah.
Yes.
Pop it. Pop it.
Kardashian abs. How does that feel through here?
Yeah, all right.
Not too bad?
Yeah,
Okay, and then come back to normal.
a little bit.
And then we're going to do a bit of side flexion. So you're going to relax your arms by your side and you're just going to slowly drop down to one side, contract through that left, opening up through the right. Good. How's that feeling? And you can see like where
That
it starts
line,
to
yeah.
angle. And then coming back. Go the other side.
What am I meant to do with my arm? Just chill.
Yeah, you just relax them by your side. It just is a guide.
You can see the shift.
You can see the shift and he's
Yeah.
starting to almost rotate. Now he's trying to fix it. And coming back up. But this one is very much, he's almost leaning
Yeah.
a lot of his body to this side. So he's struggling with that, either in the contraction or with the lengthening through the side. So once again, we're just going to go through the ranges of motion. Start off really light. We are going to give you a little bit more of an ass crack here.
Yeah.
And usually, it's good because I haven't done this too tight, but we're going to sort of go around that same sort of spot.
Yeah.
If that was really dark purple, I probably wouldn't go
Avoid
over it
it.
again. I would avoid it again. But you're feeling pretty good.
When it comes to like cups on the lower back, like where's like a no zone, are we okay to follow it all the way through?
We're pretty good with it. Mostly I like to follow the spinal sort of muscles through the side here. I avoid the bones. Yeah, that's the main thing. But if you had a smaller girl, you would have very little room.
Yeah.
So you'll probably be using less cups on a smaller person. For someone smaller, there might be like one here, and you'll already be at the
Top of the butt.
Base
Yeah.
of the butt. Whereas him, I can sort of drag it a little bit more. But let's say at any point during those movements he was like, I'm getting sharp pain, I wouldn't be doing this. If he was like, I'm getting sharp pain doing those active movements by myself, I'd be like, okay, you're already hypersensitive, you're already a little bit on edge, so I'm gonna lay you down and we're just gonna pop the cups on and you're going to be just passively sitting there breathing.
Working through it himself rather than...
Exactly, getting used to the idea that this is even on them. And then after a little bit, I'm gonna ask them just to do simple things like anterior, posterior tilts while he's laying on his stomach. But because he's feeling good and it's like, I'm just feeling a little bit tight, a little bit restricted, might have done like a bit of a gym session beforehand, he just did some squats. So now we just wanna loosen up that load. Now we're gonna go into the same sort of motion. So round your back, we're going to go into forward flexion. And you're gonna try and give certain cues like, I'm a stegosaurus. Push the cups out towards me, slowly come back up. He's already feeling quite lengthy from the upper
from
back,
your
so
body.
he feels like he can go a lot further than probably someone who's just getting their lower back done. And go again, nice and slow. And good, and coming back up. Nice and slowly, 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 slowly. How did that feel? Not too bad. Nothing grabbing.
Nope.
Good. And now let's slowly go into extension. I'm going to ask him to anteriorly tilt his hips. And we're just focusing on that lumbar sort of spine. Good. Try and relax through here a little bit. And then come back to neutral in the hips. And then we're going to go back into extension. And coming back to neutral. Good. One more. Into extension. And back to neutral.
You've
And he's
seen that
just
shift
breathing.
change.
Yeah. He's starting to like move a little bit more fluidly into that sort of extension. Now we're going to work the side flexion. So we're going to drop our left arm. Yep. Slowly work your way to the left. Try and think of lengthening a little bit through here and letting the side fall. You're not really contracting it, you're just more so thinking about the lengthening through this side. Breathe. Breathing out and then coming back nice and slow. And then we slowly go into the other side and side flexion on this side. Good. You're going to do that about 2 or 3 times each side. And then come back to normal, nice and slowly. And let's say we might be here all day if we keep going. Come back to normal. Now let's say he goes, oh, my back hurts. Rotation. I reached behind me the other day in the car, I went to grab something and I strained something in my lower back, okay? Now we want to kind of help with that sort of rotation. So bring your left arm behind you towards the end of the bed. Yep, and then slowly draw yourself into rotation. Just a little bit and come back to normal. And go to the other side. once more, going that way, holding it there for a few seconds, and coming back to normal, and going to the other side. Last one. Good. And coming back. Rotation felt fine? Yeah. Now we're gonna let go. And then we're gonna retest the flexion and extension through your lower back. Go again. How's that feel? Not too bad?
Not sure. I'm waiting for good or bad news.
To be honest, you're not really bringing your weight forward anymore. You're staying like quite in a nice line.
You haven't, yeah, he hasn't
Yeah, he's
shifted
not
forward,
shifting.
he hasn't rotated at the same time.
He's sticking between that wall like that this time.
Yeah. He's a lot more fluid through that sort of area, and then coming back up. And that felt easier for you?
Yes.
Yeah.
Yeah, it definitely felt easier.
And how about rotation? How did rotation feel?
The cups?
If we go into rotation now. And we've done his upper back as well.
There's heaps more. Heaps more. Yeah.
Yeah. And you'll be able to see it through the camera, like the difference in rotation when he first started and coming back. Good. And extension. So let's bring anterior tilt. Good. It doesn't grab as like straight away.
It's not as clunky.
Yeah.
Just sort of goes, whoop.
Yeah. You know how sometimes they go into extension and then this is just grabbing straight
Yeah.
away? Whereas he's actually got a lot more fluidity of movement in his lumbar to be able to go into extension. Cool. Done. How's that?
Good.
So this is kind of like an introduction to like just movement for the spine, for the cervical, thoracic, lumbar, just working through ranges and planes, ranges of motion and planes of movement, things like that. So you can work actively, passively, active movement, or you can just sit in there. Do you have any questions?
Yeah, if you were going to do this in a treatment, roughly how long would you spend doing it?
Doing
So obviously
that?
you do some manual work before, like working in the tissue yourself, to like warm it up, and then you apply cups afterwards. Like you were saying, like at the end of the session maybe, would you spend like 15, a half an hour, all dependent on the client?
Sometimes a client might come in and they'll go, I just want cups. You would still warm up the area and do like a basic flush through the back, and then you'd be like, okay, let's just get straight into the cups. I find it's nice to give someone manual treatment first, do around that 40-minute mark of massage, loosen, say the glutes, the lower back, hip flexors, because it depends if they've got lower back pain. It might be stemming from the glutes, it might be stemming from the hip flexors, depending if they've been sitting down for long periods of time or whatever. So if that's the case, then you just want to, I've lost my train of thought. But you want to kind of spend at least like 15 minutes, because you're going to start off with, okay, let me see your range of motion first. Then we're going to shove the cups on. Then we're going to work through the range of motion. Then we're going to take the cups off, see how that feels. And they'll go, okay, this feels better now. Now I'm feeling the tightness.
So you know like where to go, it's like an indication of
it's
like
an
a knock-on
indication.
effect.
Yeah, exactly. Because they'll be like, okay, that feels absolutely fine now, and it might be here, or it might be, oh, that's grabbing in my glute, or something like that. But it depends. If it was a first timer and they've never had cupping before, and they're like, I want a full session of cupping, I'd be like, no.
No.
We're going to do
See how you
massage
go.
first, because I don't know how you react with your body when it comes to just plain massage. How you're going to recover in a few days' time. Are you more sensitive to the touch? Cupping can be quite intense, or it cannot be intense, but if you're wanting to do something like this and do a lot of movement with it, it can be quite full on, and these marks can feel quite bruisey for a day or two after. And that's another thing. Always ask if they have an event. They're like, I know it's silly, but like, I've heard stories where someone's come in and like, I want cupping, and then she's supposed to get married on the weekend, and then, you know, they have full back of cut marks and things like that. So
Yeah,
always
cute.
ask if there's an event that they've got coming up in a week or two time, because it can last up to a couple of weeks with cupping. But if they don't, then go to town.
Yeah.
Yes. How's that?
Good.
Okay.
So a question from me. We've just finished the cupping session. I'm into training. I do all sorts of things, but mostly gym. Is there anything that I should avoid after our cupping session, or is there? And also, is there anything that I should do for homework?
For homework. So what to avoid? I would say don't do an upper body session within that 24-hour mark of us working through your back. So I'd be like, cool, go for a walk. Maybe go do a light leg program. But we want to stay away from the spine and the upper body just to help it relax and set over 24 hours, because our joints are a lot more mobile and it takes time for you to get used to that sort of feeling again. But what to do at home?
So just before we go for homework, so when you say stay away from spine and upper body, just for our community listening, what's examples of what not to do within that 24 hours?
I would not be doing a heavy deadlift session.
No heavy deadlifts.
No heavy deadlifts, no squatting, because that's compression of the spine, and we've just done so much lengthening and loosening up.
Chin-ups, pulls.
Chin-ups and pulls, like,
Okay.
it would be okay, but I would prefer just to let it relax, if that makes sense. Yeah, because we did do a lot of like neck work and upper shoulder work, which can feel a little bit tender working those same area and those back muscles, especially in pulls, because you're using a lot of retraction through the shoulder blades.
And that's for 24 hours, 48, 72?
I would say 24. But if you came to me on an afternoon and you're like, tomorrow morning I'm going to go to the gym, I'd be like, if you're going to work upper body, I would like you to really pare it back. So if you're used to doing so much weights when it comes to overhead work or something like that, you're going to take it down to the most basic level of weights and just work through the movements and find that.
So shave the load.
Shave the load.
Make it lots lighter and just go through the motions.
Go
rather
through the
than
motions.
Getting after it.
Exactly.
Yeah.
Yeah. You don't want to be. It's a very deceiving sort of feeling because you feel great,
Yes.
but you're so mobile and you're so laxy in the joints that doing something like this, it might not be used to it. Your body will be, it's kind of tricking you into thinking that you're stronger than what you are, and you can then do damage and then go home and maybe have created a tear or something like that. So you want to avoid it. Yeah.
My last question, homework. Anything that you want me to focus on?
I would be working on just moving. People are like, yeah, I want to get straight into stretching and do this and do that, and I'll trigger this, and it's like, we've already done that for you. Just chill out over the next 24 hours, but I want you to find your new norm. So you are going to be going home and working through ranges of motion through your spine, extension, rotation, side flexion, and you're working through the cervical region, thoracic, lumbar, working through hip tilts, because that's everything that we just worked on in cupping. So nice light movements, and you're not forcing it, you're not forcing the stretches, you're just slowly sort of moving in that direction and finding that comfortability in the ranges.
How many times a day? How many times a week? What are we talking? How often should I be?
How often?
Vibe it out
With range of motion?
with that homework stuff. Yeah, with the
With if you're a person that has a sedentary sort of lifestyle and you're an office worker, I'd be doing it every day. If you're a regular gym goer, I would be working it in between days of you going to the gym and doing your normal programming. So if you work out, say 2 or 3 days a week, then on the off days, you do the recovery and the movements and the mobility work. Yeah.
What's a good length of time to hit it for? Are we talking 5 minutes, 10, 15? I know it heavily depends as well, but just as a bit of a general.
Just a rough guide?
Yes.
I would be working on at least 5 to 10 reps of each movement. So whether that takes you up to 10 minutes or even up to 20 minutes, because you might have someone who feels like, oh my gosh, I'm really stiff through my upper back or my lower back today. Working through that range too quickly, people can start to seize up and they don't want to move. So don't be in a rush to move through those ranges of motion. If it takes you longer on a day where you're feeling a little bit stiff or a little bit sore and a little bit tender and sorry for yourself because you just did a heavy back session or something like that, that's okay. So there's no time frame, it's just how much you're willing to dedicate your time and your recovery to yourself and how you want to feel. Yeah. So I would at least be aiming for 5 to 10 reps of each range. Working flexion, extension, side rotation, all that sort of stuff on flexion. Yeah. Make sense?
Yay.
No! Okay, thank you for tuning in. Just to recap, we went through the cervical spine, the thoracic and the lumbar, working through ranges of motion, when to put cups on, different pressure states, going through passive and active movements with the client. Always communicating is really, really important. And yeah, if you have any questions, please pop them below and subscribe to the channel.